Hello and welcome to this podcast on dangerous environments, which is part of the pre-hospital care series. My name's Dr Cosmo Scurr. As with any of the approaches we've talked about before in the series, the approach to the patient requires careful planning and thought. And the two things to think about when talking about the dangerous environment are your safety and the safety within the scene where you're going to be working, and also using the assessment of the scene and the environment to help you in treating the casualty and in assessing the damage or the illness that they may have. It's important to realise that one of the most important differences in pre-hospital care is that you are constantly working in a different environment to which you're not used, out of the hospital, where there are these dangers, where there are these different challenges, but where the scene is important in assessing what is going on and what you need to do first. The first thing we'll talk about is using the scene to your advantage so that you can assess what's wrong with the patient and what needs to be done. And this is known as patient assessment through scene assessment. Now, when talking about non-trauma patients, this is the same as your assessment of a patient in hospital, but because you may be in the patient's home or in the place where they're normally to be found, there'll be much more information than you normally get just from looking around the bedside. But there are similar approaches in terms of you look around the patient to see what medications there are, what equipment they have for their mobility and their usual style of life. But when working in pre-hospital care, you also have the ability to look at the patient's home, and you can assess who they live with, how many people are there, is it clean, is there sign of damage? And these things can be useful in telling you what kind of medical diseases the patient may have contracted, or how they cope with their usual chronic medical conditions. For example, what modifications there are to the home. You can look at how the patient has been coping at home, and you may be able to tell whether this has been a long decline or whether this is something which has acutely happened in the last few moments. You can also meet and talk to other family members who will give you extra history, but also may give you clues as to what is wrong with the patient. So one of the most valuable aspects of pre-hospital care is assessing the non-trauma patient in their own environment and getting a holistic view of the patient and how they normally are. Scene assessment is talked about a lot in the management of the trauma patient, and this is talked about in pre-hospital trauma life support courses as well as advanced trauma life support courses. What usually happens is that you can assess wreckage of vehicles or look for weapons that have been used to harm people that you've come to assess. And doing this in a systematic manner can help you assess what injuries a patient will have. For example, in a vehicle, if there is what's known as a bullseye on the windscreen, you may be able to tell that either the driver or the pedestrian or another person has been hit on the head by the windscreen of a vehicle. And you can also tell, looking inside of a vehicle, looking at the dashboard or looking at the steering wheel, which parts of the body have sustained blunt trauma, and this can give you an idea of underlying injuries, such as rib injuries if the steering wheel has been damaged, or pelvic fractures or femoral fractures in patients where the dashboard has been hit. So as I say, one of the important things of pre-hospital care is to use the scene to your advantage to assess your patient. But again, talking about safety is very important. Scene safety is a critical aspect of pre-hospital care and gets talked about a lot, both by the ambulance service and in pre-hospital medical courses. And the things to think about as a responsible healthcare provider are the safety of yourself, so the safety of the provider, including your colleagues working with you, the safety of the patient or the multiple patients who are involved so that they don't get worse when you're trying to make them better, and keeping the scene safe so that you've got evidence for future investigations and so that no new dangers develop. And to approach this in a safe way, we use what's known as a safe approach. And that is to shout for help if you're on your own, because you'll need physical help from other people as well as support in a dangerous environment. You then assess the scene, both on your way to it and once you're there, looking for any dangers which pose to either you or to other providers or to the patient. You then take steps to mitigate the danger, which is what they mean by free from danger, by reducing things which are hazardous or avoiding areas which are more dangerous than others. And finally, you can evaluate the patient. This feels like you've taken a long time to get to a patient who may be critically unwell, but if you don't make a safe approach, you're likely to add to the problem rather than contributing to the solution. So the steps are, is it safe to even approach the scene? And if it's not, because there are still dangerous people, or if there's gunfire, or if there's a heavy amount of smoke, say in a burning building, then you mustn't go into the scene because, as I say, you will add to the problem. If you've been dispatched to this scene, so if you're working for an ambulance service, then a critical aspect is travelling to the scene safely so that you can help in an appropriate time. And travelling there safely is what we see constantly in and around cities and other areas of the country, with people driving using blue lights and sirens, so audible and visual warnings. And the important aspects are that you're trained appropriately to drive under these circumstances, that you use a vehicle which is appropriate for this and which is appropriately insured, and that it's marked so that people see you coming when you're making exemptions from road traffic law. And using these audible and visual warnings is a way of reducing the danger of travelling in a way that other road users wouldn't expect. The next stage is to make the patient safe. You may find in some circumstances that there is such a high danger, say if there is about to be an explosion, that a patient would need to be taken to a place of safety without the usual precautions being applied. So you may drag a patient out of a vehicle without adequate cervical spine immobilization if you feel that the danger is so high. But what's more usual is to find that you make the patient safe by stabilizing them, stabilizing their cervical spine, taking dangers away from the patient rather than taking the patient away from the danger, and then doing a full and appropriate assessment. And the final step is, once you've looked for dangers and reduced them, you mustn't forget that you're working out of hospital in a place where new dangers can arise that haven't been seen, and these is part of what is known as the dynamic risk assessment. So working in a team is another critical aspect of pre-hospital care, and the team is important both for the safety of the patient but also for the safety of all of the members. The critical department for this is the Fire and Rescue Service, who have overall responsibility for approaching dangerous areas, making them stable and reducing these dangers for other personnel to approach. There are certain members of the ambulance service trained in fire and rescue techniques known as hazardous area response teams, and they have much of the same personal protective equipment and training as firemen, and they are allowed to enter the most dangerous areas to deliver patient care. Usually, however, what will happen is the fire service will tell medical personnel when it is safe to approach and look after patients. The police are also very important in scene safety, in keeping people away from the scene, and in preserving evidence for further investigations. And adequate training is important, especially multidisciplinary training, with the fire service and the ambulance service working together with the police to practice for working in dangerous environments. And having the appropriate PPE, as mentioned, the personal protective equipment, keeps you safe and keeps patients safe when working in these hazardous environments. This is another summary of the constant approach in pre-hospital care and shows how important danger is. So danger and scene assessment always come first, and as you can see, that's not just to protect yourself and your colleagues, but analysing the dangerous environment allows you to ascertain what may be wrong with your patient and will help you in your treatment. And this is followed by an assessment of patient response, followed by the primary survey as discussed in the other podcast. So this was an overview of dangerous environments, and what I want you to take from this is that analysing the dangerous environment is not just for your own protection, but is also for full assessment of the patient and for giving them the best possible medical care.